The past 5 years have gone by, and you wake up with no surprise. Why? You have a pounding headache, a runny nose, and a clogged up sinus passageways. You know exactly what this means. Another sinus infection. For about 5 years, I suffered for chronic sinus infections where the only way to fight them off was to go to the doctors and get an antibiotic because my immune system was so low. Taking another antibiotic just lowered my immune system even more because my body became resistant to the antibiotics that I was using, and it also didn't think it had to fight off because it relied on the antibiotics too much. I've taken vitamin C every morning and changed my diet to eliminate nearly 90% of processed foods and dairy products, which are known to cause sinus problems. I was allergy tested and everything came back negative. I had blood tests done to different components to find whether or not these could be causing my low immune system. The results came back saying I was a lot lower than normal. However, this shouldn't be causing all of these problems. So, what could I do to prevent myself from getting more sinus infections and live a healthier life for more than just half of the time? I called a local ENT's office and set up an appointment for a consultation and physical exam. He told me that the only way that I would probably get rid of these and be successful for a long period of time would be to have an endoscopic sinus surgery. Trusting in the fact that this would truly help, I set the date for my surgery to be several months later, so I was out of sports. However, I continued to battle horrendous migraines and infections during that time, along with adjusting to my diet to eliminate even more processed and aged foods and all the caffeine. Caffeine is known to cause migraines, and especially if you are already having them from other issues, they will trigger them to happen more often and be more severe. Being the avid coffee drinker that I am, that was a struggle, but I hoped that once the surgery was over, I would be able to go back to eating and drinking like others do. Endoscopic sinus surgery is a common surgery to be done, but it usually isn't done until all other medical treatments have been exhausted for the issue. As I discussed earlier, I had been allergy tested and everything came back negative. I was immunologically tested and that came back negative. And I also had changed my diet in an attempt to have success in relieving my sinus issues. However, I didn't have any success. Therefore, I turned to endoscopic surgery. Endoscopic surgery is an attempt at eliminating chronic inflammation and infections, impaired senses of smelling, and clear obstructions such as a deviated septum. A deviated septum is where your bone is blocking one passageway more than the other. Therefore, that passageway becomes clogged and backs everything up throughout all your sinuses throughout your entire head. Endoscopic sinus surgery used to take a long time, and to recover. It was invasive near the mouth and your nose, causing scars, and it was a very painful recovery. However, after many innovations, it is now done through the passageways such as your mouth or your nostrils, where there will be no incisions, causing no scars. The surgeon uses a small lit-up telescope to guide him through there so that there's no incisions that need to be done. You will be put under, but it is an outpatient surgery, meaning you won't have to stay overnight. After the surgery, minimal packing is put in, and the recovery time is very mild in pain and very short. In fact, I didn't have any pain, and my recovery time seemed to be hours. The surgery will end up opening the passageways, creating room for drainage to flow through, giving you a sense of smell back, and reduced infections, inflammation, and migraines. These are the main benefits you will get from the surgery. However, there are other benefits that you don't technically think about. Those benefits are wasting less money on antibiotics, less stress from creating less doctor visits, and finally, living a life where you aren't constantly miserable in pain. Although the surgery will take some time to heal up the tissue which was operated on during the surgery, and you will be slightly more susceptible to infections, especially if you do it during the winter because of the dry weather causing the tissues not to heal as quickly, and the viruses surrounding you, which will prevent you from healing as quickly also. Many young adults and children don't have a fully developed immune system, which could be the cause of chronic infections. However, think about how long it could take for your immune system to fully develop. It could take quite a long time. Do you want to wait that long to start feeling better again and not expect to be sick all the time? Or do you want to spend the money on a one-time surgery and not have to deal with buying prescription and over-the-counter drugs, paying for doctor visits, and missing work? It almost seems like a no-brainer to go and have the sinus surgery and live a healthier and happier life. After the surgery, as I said before, I had no pain at all. I did take home pain medication, but I didn't need to use them at any point in time. I didn't have any nausea or any side effects associated with the surgery. I may have been slightly drowsy from being put under for a few days after, but I think many of you can put up with being drowsy for a few days to have a healthier and happier life. I also had no soreness around my nasal area and no internal pain either. I had to deal with infections after the surgery due to the fact that I chose to be operated on during the winter, which, as I stated, slows the recovery time slightly because of the dry weather and the viruses surrounding you. It also doesn't help to be in a school where there are kids all over that come to school sick just because you can't stay at home for a week straight till the virus is completely gone. Therefore, having open areas inside my nose caused infections to get in very easily. But after those few infections, I have remained healthy with no infections for the past 8 months. Although this might not seem like a big accomplishment to most people, to a person like me who suffered 26 sinus infections over a 5-year period of time, this is a huge accomplishment. I no longer have the issue of not smelling that wonderful pot roast that's in the crock pot and been brewing all day long, or my grandma's homemade fresh bread. Although my diet has still remained somewhat healthy, I consume processed foods like any other person would. I also haven't had a problem with migraines. Although they haven't been completely eliminated, I still suffer from some every once in a while. It is better than the everyday, miserable ones. They have been reduced in the frequency and severity. This is in part to less infections. Sometimes people after sinus surgery will suffer from migraines with the pressure change, like when it rains outside. However, dealing with a migraine when it rains every once in a while is much easier than dealing with a migraine every day. However, I now consume more caffeine in my coffee than I did prior to the surgery and during the times of all my infections. And I haven't had a problem with migraines in association to the caffeine, which I suggested does cause migraines many times earlier. However, I no longer need to also take vitamin C or probiotics every day either. I can tell you from first-hand experience that sinus surgery can be the answer to all of your chronic sinus issues and side effects that come along, such as the migraines and the drowsiness and just overall miserableness to your life. Don't suffer from sinus issues and miserable life any longer. There's no need to when there's a simple answer as the endoscopic sinus surgery. Call your local ENT today to schedule a consultation and have a physical examination to see if sinus surgery could help you. An ear, nose, and throat doctor could be the answer to all of your problems, and it's just one phone call away. So, would you rather suffer for many years waiting on your immunity to be built up and developed? Or would you rather just make that 10-minute phone call and go in, take off 1 hour of work, and a few days of work for sinus surgery, or take off several days over the next few years until your immune system has developed, and miss hours of work and pay for hours of doctor visits and more medicine, which is just going to continue to lower your immunity.